Ozempic babies?
Yes, it
Is
is.
there really a rise in pregnancies?
100%. People are losing weight, so they're becoming fertile. Like a lot of people couldn't get pregnant because of being overweight. And I think maybe that contributes to. Welcome to the More Than a Pretty Face podcast, where we go more than just skin deep to explore the science of beauty so you can look and feel your best at any age. I'm Dr. Azadeh Shirazi, a board-certified dermatologist, and I'm here with my co-host, Nurse Lacie. Hey, girl.
Hey, girl.
How's it going?
I am just so excited for today's episode. It is one everyone asks about.
Pregnancy skincare. We get
Yes.
so many questions and inquiries about what's safe, the most common skin conditions, what products you should stay away from. So we are going to do a deep dive into everything and anything pregnancy related, as well as some breastfeeding and post-pregnancy stuff as well.
Yes, we're going to get into all of it. I thought it'd be really fun. Instead of doing our normal beauty and blemish, let's take it back to pregnancy for us and tell me your pregnancy beauty or blemish.
Well, my pregnancy blemish is, I think I was like 4 months pregnant, and I look down and I have a spider vein like winking at me
Ew.
on the inside of my knee. And I was like, oh, heck no, this is not happening. So immediately I ordered some compression stockings, you know, the thigh highs. And I swear I never got another one after that. And I was surprised, actually. My legs felt better. They just felt better because they weren't tired, but it takes some time to get used to.
Right.
And I'll link some that I think are great compression stockings for vein prevention. What about
Yes.
you?
Oh, well, I would say my melasma was definitely the worst thing of my pregnancy, my
Yeah.
blemish.
So which came first? You found out you're pregnant or the melasma? Because as far as I remember, the doctors told you couldn't get pregnant.
This is true. This is true.
And so we didn't find out you were pregnant until you were like 6 months or something.
Yeah, I was 6 months. No, I was about 15 weeks. And, you know, for those of you that are new to the podcast, I struggled with endometriosis and I was told kids were not happening naturally for us. And so it was actually my consultation for a hysterectomy when I found out that I was pregnant. So actually, it was the melasma that came first.
Not the pregnancy test.
Not the pregnancy test. There was no pregnancy test.
There was an ultrasound before I take out your uterus when we do an
Yes.
ultrasound.
Yes.
And you're pregnant. I love that story.
Honey, she said, oh, honey. I thought she was going to tell me I had like a tumor, cancer. I didn't know
We
what she
did
was
have a
gonna say.
tumor, like a miracle tumor.
I had a huge growth in my uterus. And it was my daughter, and she's great. Okay, but before we get started, you guys, we really want to show our listeners how much we love your listenership. And so we are offering 15% off on OzemDSkincare.com, but you'll have to stay tuned and listen to the full episode for that code.
Yes, your listenership is so important to us, and we're so appreciative. It's because of you that the podcast keeps going.
Yes. All right, let's jump into it. What are the main concerns you see your patients with during pregnancy?
Well, I think there's 3 main concerns with pregnancy, right? One, we don't want to harm the fetus, right? Because obviously that's every pregnant woman's worst, nightmare. And I know that it creates so much anxiety for women. I think that mother's guilt starts the day you get a positive pregnancy test. Oh my goodness. I had a glass of wine last night, and is my baby going to come out, with 3 fingers instead of, 10? And all these things. Should I eat turkey or feta or sushi, and there's so much out there. But the truth is, a lot of times we just don't know because nobody is out there studying pregnant patients. Right? Nobody's saying, okay, we're going to give you this drug to see if it harms your baby or not.
Nobody signs up for that.
So the FDA actually has developed this rating system. It's this A, B, C, D, or X rating.
Mhm.
And depending on the ingredient, they'll rate it as A or B if it's fine during pregnancy. We have
Right.
enough data to support that it is, perfectly safe. There is the C category, which means we just don't have enough information. We just don't know.
Mhm.
And then D and X, particularly X, is like
Particularly,
you
yes.
stay away. You can't even touch this
Yes.
product because it is so detrimental to the fetus. So that
Mhm.
can serve as a guide. And honestly, you'll listen to me talk and you'll listen to another, dermatologist or maybe an OBGYN, and you're probably going to hear conflicting opinions because even though we've all read the same studies and we've all, gone through the medical training, we're going to have different interpretations. And some of it comes down to, you and your doctor. So it's really
Absolutely.
important. Some of these are personal decisions, and whatever makes you feel comfortable is what you should go with. But always, always
Yes.
talk to your doctor.
Yes,
Don't
yes.
just listen to this episode or another doctor online and, take that as medical
No,
advice
never
because,
do that.
yeah, that's not medical
We
advice.
are not here to give medical
Yeah.
advice via social media, podcast. We are
Yes.
just
Giving information, just
educating.
educational.
Yes.
So that's number one. Then number two is pregnancy is a dangerous sport.
A lot of women and
They don't
men,
realize that.
they really don't.
Yeah, it's dangerous
It's
actually.
it's funny that we are talking about that because with my 10 years of experience in OBGYN and seeing all of the miscarriages and all of
The
the,
complications
complications
and
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 God
people,
forbid,
you
even
can die
deaths.
giving birth. I mean, that is
Absolutely
a
can.
plausible. So, I mean, I say that jokingly, but in all seriousness, pregnancy is an immune compromised state, right? You're
Yes.
growing another human being inside of you. You can have, you could be more prone to infections. And I think that's one of the concerns when people come in and they're like, well, I'm going to do a laser. I want to do microneedling when I'm pregnant. Well, microneedling isn't going to harm the baby, but it might harm you. You might get an
Mhm.
infection or God forbid, you put something on and there's break in the skin
Right.
and you get an infection. So always remember that your body is somewhat immune suppressed as being pregnant, and you don't really want to stress your body either. You want to dedicate all that energy and time to growing your baby, taking care of yourself, and
Yes.
not necessarily doing elective, unnecessary procedures that could put stress on you or the baby.
Amen.
And then lastly, the last concern with pregnancy is hormonal fluctuations, right? Because,
Yes.
your estrogen's going up, your progesterone's going up, you've got, insulin growth factors and all these hormones that are just changing quite rapidly at higher states than they have ever been. And that affects everybody's skin differently. Some people think, oh my God, why does my skin look so terrible? I'm 2 months pregnant. Why don't I have the pregnancy glow?
Mhm, yes.
And that's very true because of hormonal fluctuations. It's almost like a start and stop, for your
Yes.
skin. So there are these adjustment periods. And a lot of these hormonal fluctuations cause acne, breakouts, hyperpigmentation, melasma, rashes,
Yeah.
sensitivities. And so
Well,
these are things that, could certainly happen.
let's get into it. What are some of the common conditions that we see during pregnancy?
Yeah, so acne and breakouts is actually quite common in the
Probably number
first
1.
pregnancy because it
Yes.
takes your skin and your body about 3 months to adjust. So when people say, "When am I gonna get that pregnancy glow?"
It takes
It
some
might
time.
be like in not until your 4th month, your 5th month that you really start to see a nice glow. And that
Yeah.
is because a lot of the growth hormones and the growth factors and the flushing and the boost in your circulation that makes your, skin look better. And by then, your skin's acclimated to the hormonal fluctuations and your breakouts are usually gone by the second trimester. Now, everybody's different
Everyone
because
is.
some people have morning sickness all 9 months and some people only get it like the first couple of months.
And
So,
some people don't have it at all.
yeah, some people don't have it at all. So that's, one thing that we see. And we'll talk about what ingredients are safe here in a bit. But The second common concern that we see are varicose veins that we
Mhm.
talked about, and that's because of the estrogen that goes up. And also,
The
they view
weight?
weight. You know,
Yeah.
you have the weight gain and you have this big belly that's sitting on your
Oh, the
venous
weight gain.
system and your circulation, on in your legs with the veins, bringing the blood back to the heart.
Uh-huh.
It's just the valves aren't as efficient or, working up to par because of this, weight of the belly on the legs. And so compression stockings are great at preventing varicose veins. Now, some people think that just wearing the knee-high ones
Mhm.
are fine and adequate, but no.
All the way up.
All the
All the
way
way
up,
up.
because if you try to wear the knee-high ones, what happens is then you get veins above your knees.
Mhm.
But guys, I don't want you to stress because I see some women that just get little tiny spider veins,
Yes.
and then other women develop these terrible varicose veins. I mean,
Mhm.
these things are huge and they're torturous and they just
Painful.
and painful. And some of that honestly is genetic. So it's not like you're doing anything wrong. And so don't worry. The big ones are treatable. So this is something that you can do after you have your
Yes.
baby. You can treat them with injections called sclerotherapy. There's also an endovenous laser ablation that can
Mhm.
be done that's very effective for varicose veins. And then there's also, surface lasers as well, but the injections are typically the gold standard.
Yes.
A third condition is, like you said, melasma.
Mhm.
Hyperpigmentation is very common. That's why it's called the mask of pregnancy.
Yes. And it doesn't matter how white you are, you still see it. Like, my melasma was so faint because I was so indoors 24/7 and just not I had no
But you were
color,
on the
no
screen a
tan.
lot, right? So the
I
blue
was.
rays from
I was.
screens can
Yep.
definitely cause hyperpigmentation in patches of melasma.
Yes, and I remember when I first noticed it, I thought I didn't I was like, "Man, I washed my face. Why isn't my BB cream coming
Yeah.
off?" And it was just my melasma all over
Yeah.
my forehead and my under eyes, cheeks
So
area.
I guess now would be a good time to talk about what ingredients would be safe to treat melasma in pregnancy, right?
Yeah,
So
we could do that.
So one thing, obviously, sun protection, right? And you want to use a tinted SPF to block the blue rays that come off
Yes.
of screens
Even indoors, you guys,
indoors. Yeah, because
please.
even light through windows has blue rays and
Mhm.
UVA rays. So choose a mineral-based SPF that has iron oxide to help attenuate the blue rays. And some of the best ingredients for hyperpigmentation in pregnancy are one, azelaic acid. We love azelaic acid in pregnancy because not only does it help treat breakouts, it also helps with melasma and
Yes.
discoloration. And it is one of the safest, best ingredients that dermatologists love for pregnancy.
Mhm.
And other ones would be licorice root, that is a natural plant based ingredient, as well as vitamin C. And glycolic acid is actually considered safe
But not
for
salicylic acid, right?
salicylic acid. I still think that's safe as long as it's not super high percentages and you're not like applying it multiple times a day. I think it's fine.
Mhm.
It's not my favorite for melasma, so I wouldn't use it for melasma, but I guess if you have breakouts, it's fine as like a spot treatment.
Right.
Other ingredients that are considered safe are tranexamic acid as well.
Topically.
Yes,
Yeah.
topically. So this is all skincare ingredients for melasma. And then I also really love arbutin. Now, some people will say, well, arbutin is a precursor to hydroquinone and I don't want to use it, but I think it's perfectly safe in pregnancy, honestly. And so those are some of my favorite ingredients to help with the lightening of these patches. But a lot of people don't realize it actually usually goes away after you deliver because your hormones go back down.
Yeah, I would say it took a while. I mean, I was able to use hydroquinone afterwards, and I think
Mhm.
that helped with, managing it. And then I haven't really noticed it come back. So
Yeah.
I feel very lucky in that aspect. But I was religious during my pregnancy to use the Illuma C and the Dermabright pads without hydroquinone. And my melasma was very faint. So I feel like very lucky that I saw it in time and I didn't let it get as severe as I've seen other cases, but
Yeah. I do love the Dermabright pads in
mhm,
pregnancy because it's all natural plant-based skin lighteners like
mhm.
kojic acid. It has vitamin C, it has arbutin, licorice root. And so it's one of my favorites, and it's just gentle enough where it does give you a little bit of exfoliation.
Yes.
And then the Azelaic 10 serum with azelaic acid and arbutin. So those are some of my favorites.
Okay, so we kind of got sidetracked. Let's go back to our conditions. What about stretch marks? Are there anything that you would recommend to prevent or minimize as far as stretch marks go?
It's a great question. There's been so many studies looking at vitamin E, coconut oil, cocoa
Mhm.
butter, all these, concoctions. And nothing really has proven to work for preventing stretch marks. I think a huge component of it is genetic.
Genetics, I was
And
just gonna
certainly,
say.
just because you got stretch marks like from growth spurts, like I have stretch marks on my butt, on my,
Inner
breasts, just
thighs.
yeah,
Yeah.
from growth spurts, but
Mhm.
I never got stretch marks during my pregnancy.
Same.
So just because you have stretch marks doesn't mean you're going to get them. Now, if you get them, it's not the end of the world. Stretch marks are so common and you can treat them after. But what I do think makes a difference is massaging and preventing rapid weight gain.
Yes.
So you don't want to, all of a sudden just gain enormous amounts of weight because that really does stretch your skin. Because
It's
stretch
kinda hard
marks
though
are
during pregnancy.
it can be hard, but some people say, "Well, I'm eating for 2 now,"
Yeah,
and you're
true.
really
Yeah.
not. So I think you only, you don't need that many more calories.
Yeah.
So just be mindful of that,
Yeah.
just be healthy and don't do anything, extravagant. But stretch marks are like tears in the skin. They're very
Mhm.
similar to scars.
Yes.
And we can treat them with lasers such as the V-beam laser or fractionated resurfacing lasers like the profractional. The sooner you treat them, the
The
better
better.
when they're in their kind of the red stage of healing. And that might not be possible until, you know, 3 to 6 months after having a baby, because you do want to wait until you get your normal periods back. So your hormones are back down to baseline
Mhm.
before you start doing lasers and things to the skin. And the reason being is, again, the hormonal fluctuations makes it just unpredictable in terms
Unpredictable.
of your results. But I do love Bump Butter by Bumpology, and just using that every night, massaging the belly,
Mhm.
and it's very nourishing, it's very moisturizing. A lot of my patients swear by it, they
Yes.
love it. So check it out from Bumpology. I will link it in our pregnancy products as well.
Yeah, I was terrified, but I was also like, well, my mom didn't have stretch marks on her stomach, but like my growth spurts, I have it on my outer thighs and my inner thighs. And I'm like, oh, I don't want to risk it. I was religious every night,
Yeah.
cocoa butter all over my belly and just
Yeah.
that massage, I
I think
think.
just cocoa butter, coconut oil, olive
Mhm.
oil, any of those things are acceptable if you want to get, super natural. And then the other thing that we see in pregnancy, particularly in the last trimester,
Mhm.
are rashes. There are, hives and certain conditions that we see that pregnant women develop.
Pups.
PUPS, yep,
Mhm.
is pruritic urticarial papules of pregnancy,
Yes.
and it starts like around the belly button.
Mhm.
Hopefully you guys won't get this because it's super
I hope you
uncomfortable.
do not.
I think
Yeah.
it's quite rare to get, but it is important that if you do develop any rashes at all, you call your doctor right away,
Yes.
because sometimes skin rashes are a manifestation of things that are happening inside of our body that might be pregnancy related. So you
Yes.
always want to make sure that you contact your doctor and see a
Mhm.
dermatologist to make sure that it's not just hives or it's not just, some of these benign skin sensitivities that we see.
Right. Okay, so let's jump into some skincare products that you would absolutely want to avoid during pregnancy.
Well, again, there's a lot of products that a lot of doctors will say, no, don't use that, don't use that.
Yeah.
But there's really four that I would say I personally wouldn't use in pregnancy. And I tell my patients that to stay away from.
Mhm.
The first one being hydroquinone, just
Yes.
because we know that, that can get absorbed through the skin into the bloodstream. Two would be retinoids. So anything like retinol, retinaldehyde, retinol palmitate, tretinoin,
Mhm.
Tazorac, which is the strongest retinoid, and it's a category X. You want to stay from any retinoid or vitamin A, products or derivatives. And the third one would be minoxidil, like Rogaine, those hair growth agents you want to stay away from. And then the fourth one, essential oils. And a lot of people say essential oils, like why? They're like
Why?
natural and this and that. But the formulations are really variable. Some of them are like 50 times as concentrated as others. Some can actually be pretty toxic and can lead to premature uterine contractions.
Interesting.
Yeah, like tea
Yeah.
tree oil, rosemary oil. They can also cause these blistering rashes like
We don't want
contact
that.
dermatitis. And again, because your skin is more sensitive during your pregnancy and you're at an immune compromised state, so you're going to be more prone to infections and you're more prone to hyperpigmentation. So if you put that citrus oil on or that eucalyptus oil on that's super concentrated, but you don't know that, right? Because
Yeah.
they're not really regulated, and you get a reaction, you're talking about, a lot of potential bad things can happen.
Yes.
So I would try to stay away from essential oils altogether if you can. Use things like olive oil, cocoa butter, things like that. But yeah.
I will chime in and I will say that if you didn't know you were pregnant and, went through similar, like what I went through and didn't know I was pregnant and did use a lot of those things,
It's not the
don't
end of the world.
stress.
Yeah.
Yeah, please don't stress. Stressing is probably the number
Worse.
one
Yeah.
worst thing that you could do during your pregnancy. Just move on, stop using the products and just go on with,
Yes.
everything's good, everything's gonna be okay,
And,
and it
if
will.
you're listening to this podcast and you're stressed, right, because of, oh my gosh, I did X, Y, and Z, and it's not pregnancy safe. You know what? The fetus is actually quite protected in the womb. And I don't think people realize that because you have that one friend, who drinks her wine every day and has her sushi every day and she's pregnant, right?
Right.
And then you have the friend who's like afraid to have feta cheese or turkey, because of harm to
Yeah.
the fetus. So there is that spectrum. You just have to find the happy medium for you and see what feels good and right to your body, but
Yes.
always talk to your doctor and get their input as
Yeah.
well
Yep.
because every case is different, right?
Every case is different.
We have the most amazing podcast community, and we want to thank you for being such a loyal listener. To thank you for being a fan of the show, we want to extend 15% off exclusively to podcast listeners. Use code SUMMER15, that's SUMMER15, now through the end of June. This is a special discount we're only giving to our podcast listeners to get 15% off your favorite products at Aussie MD Skincare. Don't forget to tag me in your stories. I love to see you glow.
Right.
So we talked about things you should avoid.
Yes.
But what about things that you can use? And I get questions on this all the time. Can I use
Yes.
this? Can I use
Yes.
that? Well, let's start off with exfoliating acid. Glycolic acid, lactic acid, mandelic acid. I consider these very safe in pregnancy. Salicylic acid is a little bit more controversial, if you will. I think it's still considered safe, but maybe use lower percentages or maybe use it as a spot treatment instead of, in a lot of products.
Right.
But those are great at brightening the skin. They work really well for acne. They work well if you have like skin texture, you want to smooth the skin. And they're great exfoliants. And so some of my favorite products are ones by The Ordinary, which is like a 7% glycolic acid, super affordable. L'Oreal has one that's a 10% glycolic acid serum. You can also find lactic acid in lower percentages like 5%, 7%, 12%. That works great for those bumpy bumps on the back of their arms called
Yes.
keratosis pilaris. Some people call them chicken skin. You can also
Yes.
get them like on your thighs. So Amlactin is a line that has a lot of different lactic acid products, and that works really well for dry, bumpy skin.
I have a question.
Yeah.
I saw a video the other day of an esthetician saying that, everyone forgets their eyes and, stressed sunscreen, moisturizer, but she said and recommended, and I've never heard you talk about this, so I wanted to ask you, lactic acid under the eyes.
Well, it's a very gentle acid. It's great for dry skin.
Mhm.
And so it does help with removing dead skin that builds up. And so it does help with exfoliation and smoothing lines and wrinkles. So I think it's a great option for
Yeah.
under eyes. It's also a humectant, similar to glycolic acid. That's also a humectant. So it does help draw water to the skin. So if you particularly develop
Ooh.
like dry skin, as we don't know with the hormonal fluctuations
Mhm.
what kind of skin, you'll have. Most
Right.
people, have great skin in pregnancy because the hormones are so great. But yeah, I think lactic acid is fine even around the eyes. I particularly like it for the lip skin as well, because it does help hydrate and smooth the lips. So I like it overnight.
Okay, good to know, good to know.
So moving on, azelaic acid we touched on already. I think that's
Yes.
very safe. It's one of dermatology's favorites, and some options are Paula's Choice. There is azelaic 10
10.
serum, which
Mhm.
is by OzMD Skincare, and The Ordinary also has a 10% azelaic acid. Azelaic acid is difficult to formulate, and I find that a lot of products kinda leave behind this residue on the skin, so you just have to
Mhm.
find one that you really love and like, but I will link them in my product sections.
What about tanning products?
Tanning products are safe, but I would avoid the ones that are sprays, like, the
Oh,
spray
okay.
tans, I would avoid that.
Like foams and
Are
creams.
better.
Okay.
So self tanners, they have a ingredient called DHA, which gives you the color, right? It binds to the dead skin that's on
Yeah.
the outer layer of your skin, and so it doesn't get into your bloodstream. So
Okay.
it's perfectly safe. The only thing with the spray tans are you don't want to
Inhaling
inhale
it.
it. Yeah.
Okay.
So I think
Okay.
that's the main issue. I love the one by Saint Tropez. They have a mousse that is really great, and
Yes.
then Jergens is a great drugstore one.
Yes, I'm a
That's like
fan of
a Yeah,
Jergens.
that's like
Yeah.
a cream, and it just, like, builds slowly, so you can
Mhm.
use it, like, every day until you get the color you want.
Yes.
And then there's one by Coco and Eve, Sunny Honey, and people love the fragrance, the scent to that one,
It
but
sounds like
that
it would
also
smell
comes
good.
as a mousse. So those are great options. You want to, like, exfoliate before, so you can use, like, a glycolic acid spray, like the one spray is 10% glycolic acid, or some of them actually come with, like, a physical, like, scrub glove
Glove, yes, I was
that
gonna
you
say
can
that.
do, because that just allows the active ingredient to better bind to the outer skin layer.
Mhm. I will say I was never a fan of self-tanners because of the exfoliation part, like, I just didn't do it right, so then I would have, like, streaks or blotchiness or just, like, I don't know, I just
Yeah, well,
hated it,
yeah,
wasn't it
some of the
wasn't for
formulations
me.
also, like, when they come out, they kinda run, they don't
Yes,
distribute
yes.
evenly.
Mhm.
So, sometimes it's that, but I find the one spray is so easy because you just spray it, you don't have
I
to,
do
like
love it.
it makes exfoliation easy.
Mhm.
So, other ingredients that are safe, hyaluronic acid, vitamin C are
Mhm.
perfectly safe. Sulfur is another dermatology favorite if you suffer from breakouts, rosacea, you have sensitive skin, but you have, breakouts as well. That's
Mhm.
a great product. Vichy has a 10% sulfur that is great at, kind of targeting areas of breakouts. Another favorite ingredient that is safe is licorice root.
Yes,
And
yes.
I love licorice root because it's so gentle, it's
Mhm.
calming and soothing, it's great for
And
hyperpigmentation.
that's in the Dermabright pads, right?
It's in the
Yeah.
derma it has
Mhm.
this nice brightening effect, and
Mhm.
it's all plant-based and natural, as is arbutin, is great for hyperpigmentation and melasma.
Mhm.
Now, this one surprised me. I couldn't believe that people would be like, I don't you wanna use it in pregnancy." Is aluminum in deodorants. Have you heard, like, your friends or colleagues say,
You know,
"Don't use aluminum in deodorants if you're pregnant because 'cause you're gonna
I
get, like"
I have
I don't
people
know,
that just don't wanna use it in
period?
general, not just pregnancy, so I can see
I
that
don't know,
one.
with
I can
summer
see that
coming
one.
up,
You
I would if
know,
you're sweaty and
put the
stinky
deodorant
and
on,
you're already,
please.
like, pregnant, especially if you're, like, in your last
Yes,
trimester,
you get
you get
hot.
your body temperature is naturally
Yes.
elevated when you're pregnant.
Mhm.
And so I think it's perfectly safe. I
Yeah.
don't have any
I
issues
I
with
wore it.
I use deodorant, and I think we're all here. We all
Yeah,
use deodorant in
we
pregnancy,
do.
and
We
I
have.
think If you think
And,
about, like, or, like, people that don't have anything plastic. I hope I'm not pissing anybody off who's listening
we're
to
gonna
this,
piss a few people off, and I'm sorry.
but it's just to
With peace
relieve
and love.
anxiety, right? Because we have this anxiety about everything around us, right?
You
About
know,
plastic and this and that, and I just don't want that to stress people out.
there is a lot of anxiety in general, and then when you bring pregnancy into it, I feel like so many women just are hyper anxiety, and I saw that when I worked in OBGYN, I still see that in dermatology.
Yeah.
You just
Well, you
everything
get
in
into this rabbit
moderation.
hole, right? Online, these
You
online forums and things. If you think about it, I mean, our life expectancy and our pregnancies are doing much, much better than they did in the 1800s. I mean, a
Yes.
lot of people lost babies and it was much worse statistics. And
Mhm.
there was no plastic back then, and there's plastic now. So, but that's just,
Yeah, and I will say, I love the women that set out a plan for their pregnancy. That's great. I love that. But don't overstress and feel like everything has to go the way that you planned it. I I have seen so many women that are like, I'm going to have a natural birth. I'm going to do things this way. And you can't predict that.
That's like me. I
You
was like, "I'm not
cannot.
gonna get an epidural. I'm gonna wait as long as I can because if when you don't have an epidural, that pain
Mhm.
releases natural oxytocin, which is better for a faster
I don't
delivery.
know.
But by the time I got to my second pregnancy, as soon as I got to the hospital, I was like, "Give it to me."
Yes,
Like, the
yeah.
first pregnancy, I was like, "No, I'm gonna hold off," and this and
Mhm.
that, and yeah,
Yeah.
I think things change.
For somebody who has witnessed all spectrums of birthing, I will say I absolutely knew that I was not planning my pregnancy, delivery, what you may have, or whatever you call it. But I went in at 2 days late and was planning on just pushing her out and getting it over with, and ended up with an emergency C-section. And it was terrifying.
Yeah. Well, I think that's
And
one of the terrifying things about pregnancy is that you don't have control.
you do not have
So
control.
don't try to control the
Don't stress
situation.
over
Yeah.
your birthing plan. Don't stress over your pregnancy.
Yeah.
What happens will happen, and just
Yes.
love every
We just
second
want
of
you to
it.
be happy. If you're pregnant, just be happy
Be
and stress
happy,
free.
even if you didn't plan
You're
it and it was a
growing a
surprise.
miracle. Okay, the last ingredient I'm gonna get to, which has
Oh,
been
yeah, we're still on
all
ingredients.
over all over the, news, it's been all over the dermatology literature, and that is benzoyl peroxide. And the
Yes.
fact that it degrades into benzene, which is highly carcinogenic. And
Mhm.
this is a tough one because I think, they made some pretty good points. This Valisure, which is a company that went out and tested all these benzoyl peroxide products. Now, I still recommend it to my patients, and I think it's a great ingredient
Yeah, just don't
for
eat it, right?
acne. Well, let's get to that. So, yeah, don't eat it. But I think it's a great ingredient, and I find it to be safe in pregnancy. And some of my favorite products are, the ones with the lower percentage of benzoyl peroxide in it. But as long as you don't keep it for too long, so maybe you just try to use it up in 2 to 3 months. Try to keep it in the refrigerator to reduce the likelihood of it breaking down into something you don't want it to break down
Mhm.
to. I think that it's still a good option
Okay.
despite all the negative press it's been getting. I love the Gentle CeraVe foaming acne cleanser. It has 4% benzoyl peroxide. Cetaphil has a 2.5% micronized benzoyl peroxide that I also love, as well as Neutrogena actually has a 2.5% spot treatment. So I still think it's very safe. If you do use it as a cleanser, be sure
Mhm.
you leave it on for at least 30 seconds. Otherwise, benzoyl peroxide just doesn't work as well for you. So try to leave it on almost like a little quick mask. You put it on, wait a minute and then rinse it off.
Okay.
So I think that's our ingredient
Ingredients. Okay,
list
good.
for everything.
I've been dying to ask you.
Yeah.
You know how some women are like, "Oh, I just feel like I'm having a girl because all of my beauty has been stripped away or
Oh,
is going to the girl." What are your thoughts on
yes.
that? Is there, like, some reality here, or is it a hormonal thing?
It's definitely an old wives' tale,
Yeah.
and there's no scientific study that says if you carry the baby up high or down low, or
Yeah.
you're, pear-shaped or apple-shaped, or I don't know, they come up with all these, like, scenarios.
Yes.
Yeah, there's no, now first pregnancy versus second pregnancy can look different, because your
Sure,
body
yeah.
changes. But yeah, no.
No.
Yeah, I would say that's a no for me.
So, did you have any pregnancy symptoms where you were like, "I am for sure having a girl"?
I loved being pregnant. Like,
Okay, so did I.
up until, like, 2 days before I delivered, I think I saw, like, 40 patients or 45 patients, like, 2 days before I delivered.
Yeah.
And I didn't really even show that I was pregnant until I was, like, 5 months.
Yeah.
I really wanted to show, and I think everybody's different, and I was so worried that, like, my baby wasn't normal because I didn't look pregnant and this and
Mhm.
that, and I went through so much drama with my OB because they kept measuring my first daughter's, head, and they were like, "She has microcephaly." Like,
Aw,
her
yeah.
her head measured less than 5 percentile, and, I mean, to the point where we're like, "What should we do?" Like, she's gonna
Right.
have, like, we thought she was gonna be, like, have severe,
Problems.
yeah, problems and
Mhm.
so forth, but yeah, they just don't know. We just don't know until the baby comes
It's
out.
true.
Is this my sorry, it's going off. What is it?
Rude. No,
I'm
I'm
like,
just
and I'm
joking.
getting irritated. I'm like, "Whose phone is that?" And how rude. Who left their phone on during a podcast recording? I'm getting pissed off in my head, and
This
then
girl.
it ends up being my phone. Okay. Alright, so moving on.
Okay, so then
I feel like we'll stop for a minute because I feel like we're is it Kentucky? Does somebody need to point? Okay.
so moving on. The episode you did with Dr. Mary Claire
Yes.
about Ozempic and
Yes.
seeing a trend in Ozempic babies,
Yes, it
is
is.
there really a rise
There's
in pregnancies?
100% because I'll tell you why. People are losing weight, so they're becoming fertile. Like, a lot of people couldn't get pregnant because of being overweight, and I think maybe that, you know, contributes to being stressed or whatnot, but they're just healthier, right? The
Mhm.
healthier that you are,
True.
the more fertile that you are,
Yeah.
right? And people on Ozempic, I mean, they've been able to lose weight they haven't been able to lose in decades, and
Yeah.
think of how that would make you feel.
Yeah.
You'd be so
Sexy.
happy, so sexy, so ready to,
Mhm.
get it on and
Yeah.
get pregnant, and I think that's part of it.
I
I
love
think,
it.
we're gonna see
Ye
a Ozempic baby boom,
I
so stay
love
tuned for that.
it. Okay, well, let's dive into Ask Dr. Ozzy, where our listeners send in their questions and we have the expert
I
answer them.
I love hearing from you. So if you guys are on Instagram, follow us at More Than a Pretty Face Podcast. DM us with your questions. If you're listening to this episode, take a screenshot, share it to your stories, and be sure to tag me at Skin by Dr. Ozzy so I see it. I love hearing from you and I love answering your questions. So
All
let's
right.
get started.
The first question is from Emma on Instagram, and she writes, "Good morning, Dr. Ozzy. First, let me thank you for the suggestion about Bumpology bump butter. I love it.
I love it.
What can I proactively apply to make their appearances less visible?" I'm assuming her stretch marks.
Yes. So I think while you're pregnant, we talked about, you want to really try to avoid retinoids or any sort of medicated topical or any lasers and things like that. So the safest thing is like massaging with the bump butter is great. Clarins also has a pregnancy massage oil
Mhm.
that I use because bump butter didn't exist back years before from when I was pregnant.
Back in
So
your
just
day.
just avoiding that rapid weight gain and, nourishing and massaging the skin at night really helps.
Mm.
Once you have the baby and you have the stretch marks, what can you do? Well, retinoids really help. You can get a prescription for Retin A from your dermatologist, or you can use a retinol like Lift and Renew, which also has bakuchiol in it, and use that, nightly as a massage. And then using lasers like the V beam, early stages, like when the stretch mark is still red, can really be helpful, as well as resurfacing lasers like the Fraxel, the Halo, Profractional laser are great. I wouldn't try to do the CO2. I think that's too aggressive for stretch marks. Also, microneedling can be helpful as
Mhm.
well for stretch marks. And so that is something you would want to do after you have your baby and once you get your period back, because that's when we know your hormones are back down to their baseline and we're not going to have complications like pigmentation and so forth from the hormonal
Yes.
fluctuations.
I was just gonna add, what are your thoughts on, sun protection of those areas too during pregnancy and even
Always
after?
helpful, yes, because you don't want to expose them to direct UV rays because UVA particularly can penetrate quite deep and
Mhm.
worsen your stretch marks. They can pigment them, making them darker, staining them, and, further degrading the collagen loss that we see in stretch marks.
All right. Our next question is from Angela, and she writes, "Hi, I wonder what I can use instead of retinol at night while breastfeeding. I heard that you should not use retinol during pregnancy and breastfeeding."
So bakuchiol, which I didn't talk about in our list of ingredients,
Yes.
is pregnancy safe. It's has similar effects to retinol, so that would be a great option if you're pregnant. You can also do glycolic acid, which has benefits in terms of stimulating collagen. It also helps exfoliate the skin and remove the dead skin layer.
Great. Question number 3 from Lady Madeline asks, "Hi there. What should I do to treat pregnancy related acne? It's really impacting my confidence."
Oh, I hate that, but I
Hmm.
hope that you're only in your first trimester because I
Yes.
promise it does get better for 98% of people. There's always the outliers,
Right.
but, I love azelaic acid. It works great for acne, breakouts, pigmentation. It's a really great gentle exfoliant. Even if you
Mhm.
have the most sensitive skin, that's a great option. Sulfur is another one that works great for acne. Again, it's calming and soothing, safe in pregnancy. We talked about benzoyl peroxide. That is a great ingredient at, reducing acne bacteria, removing dead, skin cells from the skin, and just does a really good job with all types of acne. So those would be kind of my top products. I do love the Clarify pads as well for pregnancy just because they're easy to do. They're also really gentle.
Mhm.
Even just using maybe a salicylic acid cleanser is fine, even though we said, salicylic acid is one of those
Iffies.
iffies, but I
Mhm.
find it still to be safe.
All right. Our last question is from Jackie on TikTok. Would you consider doing a safe and effective products post for dealing with postpartum breastfeeding skin? I know I'm not alone in feeling like my skin isn't my own right now. Thank you so much for the consideration.
100%, guys. So I will make some posts with these products. You can also use the link below on Shop My Shelf. I will create an entire shelf of pregnancy safe ingredients and products that you guys can look up and look into. We'll also do some posts on Instagram at More Than a Pretty Face Podcast so that you can save that for your records. But I love this episode. I loved hearing from you guys. Thank you so much for tuning in. And remember, sharing is caring. So if you found this episode helpful, share it with a friend, post it to your stories. We love seeing you.
Yes. Have a great day.
Have a great day. Bye, guys.